Hello, welcome to Adapt English, and thank you for joining this channel. I appreciate that. I have a very short question and a very good one on endocrine. It's just a form of a lecture, but in the question form, to give you a perspective of that disease process I'm going to talk about. And I'm going to use a new generation flavor so that you can see where they can lead you to. And this is what we have. A 30-year-old male client was diagnosed with rheumatoid arthritis. He failed multiple drugs and eventually was placed on a 40 milligram of prednisone daily. He presented to the clinic for follow-up. Which of the following the nurse should anticipate? Select all that apply. And so when they give you this kind of question, so many words, don't worry about it. Just sit back, relax. Don't worry. Don't sweat about anything. Just sit back and say, okay, give me too much information. I need to break it down so that I can take ownership, whether it's the next generation or the traditional one. Sit back and said, I'm going to take care of this question, but I'm going to be in charge of it. And so the way I do my every question strategy is to read the last portion. So read it backward. They give you a forward question, but read it backward, because guess what? The examiner will put the buzzwords in the last portions of the question. So go get the buzzwords and then you can use it to answer the question. So select dot apply. Which of the following the nurse should anticipate? So I'm looking for something I should anticipate, right? Then you read the rest of the stem. A 30-year-old, I circled that as my buzzword. Client was diagnosed with what? Rheumatoid arthritis, an autoimmune disease. He failed. So multiple drugs, that means multiple medications, and eventually was placed on 40 milligram of prednisone, which is a steroid, okay, daily. That's a lot of steroid. He presented to the clinic, so he came in for a follow-up. Which of the following you expect? So your ask is what? What do you expect? The case, somebody is on steroid. That's all. All these long sentences, I don't care about it. He's on steroid. How many? 40 milligram a day. And he's here for a follow-up. And they want you to know, what do you expect? When you see this pharmacology question, whenever they give you a drug, look for side effect, unexpected finding for that medication. And if they ask you for a priority question, yeah, you look for the one that is going to be dangerous. So if somebody is taking steroid for 40 milligram for a couple of months, I should worry about it, right? They've been taking it for a long time. Okay. And so you have to be thinking about what is going on with the patient. He has taken this medication for a long time. Therefore, you should start thinking like, hey, something is wrong. If I'm 40 milligram of steroid for a couple of months, things may change. And this is where you bring your pharmacology to endocrine. So it's a system problem. Don't separate when you learn. 40 milligram of steroid for a long time, I see you as somebody who is a Cushing problem. So I've made you a Cushing disease patient. And therefore, everything a Cushing patient have, I should expect a little bit of it, not the worst one, but you should start seeing signs of Cushingoid. I call it Cushingoid symptoms. You have Cushingoid symptoms, but you are not a Cushing patient, but you've developed a Cushingoid symptoms because you've been on steroid, excessive amount of steroid for a long time. Then you ask yourself, what does steroid do? That's all. That's what the question is about. You breaking it down, thinking before you look at the answer. If I'm on steroid, think about what the steroid will do to you. And you start thinking about signs and symptoms of Cushing. Well, your sodium is going to do what? It's going to go up, okay? Because of the renin-angiotensin system, and it hold on to water, okay? And therefore, you get fluid overloaded, water, right? Steroid make you risk of infection, right? And they help you build fat down. They don't let you break down fat. So you deposit fat just like that. So you gain weight, right? And you gain weight at places that your body like, in the central portion of the body. Okay. And it's a stress hormone. If it's a stress hormone, well, your glucose is supposed to go up. When you're stressed, your body make more glucose. When you take stress, when you stress, your body release stress hormones like epinephrine and norepinephrine. Guess what? Your glucose go up in order to use energy. So I've given you some brief information about steroid. That's the side effect. These are all side effects when you steroid. Then you look at your answer choice. You say, this is what I expect. Weight loss, no, I'm supposed to gain weight. Okay. Systolic blood pressure, at least 10 millimeter per mercury below the value 6 months ago. I just told you, supposed to be hypertensive because of retention of water and sodium. So their blood pressure should go up, no down. And therefore, this is wrong. A serum, sodium above the normal value. Yes, they don't give it to you. So far as they say it's above the normal value, I'm picking this answer. Random glucose of 250. That is too high. 200 is like diagnosis for diabetes. So 250, yeah, that is expected because you need more glucose in the steroid form. That's why they have too much glucose. Potassium of 5.5. Think. Cushing and Addison, what do they do? Yeah, wherever your sodium goes, potassium doesn't like it. That's another way of thinking it. I don't want to break it down, the renin-angiotensin system, but if you have high sodium, potassium doesn't like it. In order to balance the charges of the cell, to maintain the charges of the cell, sodium and potassium are enemies. So if their sodium is going up in Cushing or on steroid, well, your potassium goes down. And therefore 5.5, I don't expect that. I expect something lower than that. So this is wrong. Increase abdominal waist circumference. Like I told you, your body starts to deposit fat in the central portion. So you get central obesity. Central, from the back of your neck, your face, your chest, your abdomen, and your waist. So central obesity. So I expect that. Salt craving. Their salt is already high. Why would they crave for salt? That is consistent with Addison problem. Therefore, they don't. And so we have 3, 4, and 6. And so weight loss, no, weight gain. Blood pressure goes up. Sodium should be above normal. Glucose should be high. Potassium should be low. Central obesity, so there's increase in waist circumference, and they shouldn't be craving for salt. They have too much salt on board. And that's how you do SATA question. I never compare anything. I came up with my plan, and I attack it one by one. I knock them down. You not keep on knocking them down. You don't compare it. That's how you do it. In the next generation, like traditional, but you thinking, thinking and answering the question, making differential diagnosis easy. And then the client abruptly stopped the steroid due to lack of refill for 4 days and presented to the emergency room by EMS for evaluation. Now they stopped the steroid because they don't have a refill. And they came into the emergency room in the ambulance. What do you think? These are the teaching you teach anybody on steroids, that you should not stop the medication abruptly. Why? Because your adrenal gland make steroids, okay? It need to make a certain amount of steroid for you to function a day. If you don't, your adrenal gland doesn't make steroid a day, you are in trouble. You get really weak. You get confused. All the symptoms of Addison. So when you start taking steroid, your adrenal gland said, thank you very much. I don't have to work anymore. So I will shut down. So your adrenal gland shuts down. And then he's expecting you to keep on taking your steroid. When you're ready to come out from the steroid, you taper. You can take like 2 weeks, sometimes 3 weeks to taper it. So if you're taking 40 milligram, you go down to like 30, 20, 10, and you can stay on this for a long time, for a week, then 5 before you come out for me. So that's taper. He's telling the adrenal gland, hey, you got to wake up and make more steroid because I'm not taking you extra steroid anymore. If you stop right away at 40, your adrenal gland is dead. You need to wake up. It's sleeping. Okay. It will take a long time to wake up. So you get sick. So these patients stop their medication right away and therefore they are in trouble. So what is your presumptive diagnosis? In the next generation, they will give you multiple choice. They will let you find out what it is. In traditional one, they want to find out what is the diagnosis, but I did not want to give you multiple choice. So the presumptive diagnosis is adrenal crisis. That's what we call it. They are in adrenal crisis. Then number 2, this is what I want you to work on. Which of these findings are consistent with the diagnosis below? I intentionally did it this way so that if you're doing traditional one, you can see you have to know all these 3. If you're doing next generation 2, you have to know all these 3 to be able to distinguish it. And therefore, I want you to distinguish it. I've given you the signs and symptoms. Okay, I've given it to you. Just put it back to where it belongs to. In a traditional one, you won't get it. But this is what you need to know, right? So you need to tell me which one is Cushing, which one is Addison, and which one is adrenal crisis, right? High sodium. So who has high sodium? Cushing, like we said. Addison, no. Addison crisis, no. High potassium. Cushing, no. Addison, yes. Crisis, yes. Bronze pigmentation. This is one of the things that is specific to Addison because when the Addison people, the adrenal gland cannot make steroid or aldosterone. So it's shut down, and in the your body from the hypothalamus make from the pituitary down to the adrenal will secrete ACTH, and this hormone regulates secretion of steroid. Since there's no, you can't secrete them, your body doesn't know. It keep on making more ACTH, but ACTH has melanin in it. So you have high level of melanin in Addison, and therefore they are the only one who have pigmentation of their skin. So bronze pigmentation is in Addison disease. So this one wrong, and this one is correct. But guess what? In adrenal crisis, you don't have the time to make that. So it's a trick and it's a trap. They don't have bronze pigmentation because it just happened right away. So your body doesn't have enough time to compensate. Systolic blood pressure of 80, where that is hypotension. In Cushing, you have hypertension. In Addison, yeah, your blood pressure should be lower, but it should not be 80. So this is a little bit tricky. It's usually in the low range, 100, but because they're taking steroid, but 80 is too low for me. I won't choose that. This is example. In the test, they won't give you 80. They'll give you normal this thing, but I will not put it under Addison because it's too low. That tell me you are in shock. Addison people walk normally, so they shouldn't. Adrenal crisis, yeah, these people are in shock because they just stop their medication and they turn into adrenal crisis from steroid, being on steroid and stopping it and going into crisis. So yeah, they have hypertension. Abdominal pain. Cushing, no. Addison, this is classic. This is another classic. So bronze pigmentation and abdominal pain. And it's due to from the dehydration. That's what causes the abdominal pain. So yeah, of course, adrenal crisis, they are dehydrated. Therefore, boom. Weakness. Yeah, you are hypotensive, you're weak, you have no sugar. Yeah, you should be weak for Addison and adrenal crisis. Steroid, no, too much. They have too much energy. And confusion. These people are in shock. Adrenal crisis patient, they are in shock. Okay, And so they are confused. Addison people are not confused unless there's emergency when they come in crisis. So there is difference between Addison and adrenal crisis. And therefore, they won't be in confusion. They'll be normal. This one too will be. So this is how you can break down the difference between the three, and you can start to break it down in terms of whichever test you're going to take, and how you can do differential diagnosis and manage patient, because this is life. Okay, but it's a form of SATA. I've given it to you, and you got to put it at a column that it belongs to. You have to know the disease process. Just because I've given you the answer doesn't mean, oh, you can just put it anywhere. No, you get it wrong, and it will take mark from you. It's not free. They will take marks because people will put marks, or they can check everywhere where they will deduct the marks. So you're just losing. Okay, if you select all, you get 0 for that question. So that's another way of getting you. Now we're back to the traditional, and it's the same thing. They can also ask this in the new generation. The nurse should anticipate which of the following prescription for the patient. SATA form. Select all that apply in a SATA form. Patient is in what? Adrenal crisis. First, they are normal. You give them steroid for a couple of months, right? And you make them Cushing. Now they stop the medication abruptly. And what you've created? Adrenal crisis. They are in shock. They are like Addison. They are in shock, hypotensive. They are confused. Their glucose is low. Potassium is high. Sodium is low. So you got to help this patient. IV fluid, what is wrong with it? Give it to them because they are in shock. Fludrocortisone, this is what will give them aldosterone. This is an aldosterone. Adrenal people, Addison people are mixing aldosterone. That's why the potassium is high. That's why adrenal crisis people too. So they're missing aldosterone. So fludrocortisone is a drug which is a form of aldosterone. So give it to them. Hydrocortisone, this is the steroid itself, the Cushing, the glucocorticoids. This is what increases your glucose. So yeah, give it to them. Dopamine, well, it's a trap, right? You don't want to give them any pressures, okay? Don't give them pressures right away. What is their problem? The reason why they are in this form is what? Just give them what they need. All they need is their steroid. You don't give them process right away. So somebody will say, well, I'll pick that answer. Well, if you give them the steroid, they will be fine. They're going to be fine. So we just put them on steroid. If you're giving them a lot of steroid and they are not responding, yeah, then you can support them. But most of the time, steroid is all they need, steroid and fluid from the dehydration. So I will not choose dopamine. Potassium, right? Their potassium is already high. So I'm not choosing that. But like I said, number 4, somebody will say, well, you got to improve their blood pressure. What they need, if you give them steroids right away, boom, they are normal. That's the only thing causing the problem. And so just give it to them and they will get normal. This is content for endocrine, tackling Addison, Cushing, adrenal crisis, new generation, and of course, my favorite, select all that apply, making you comfortable with this problem. Don't fear it. Don't worry about it. Just attack each answer. Just make sure you get enough solid content to analyze what they are asking you, and then tackle the question one by one, answer choice one by one. Thank you for listening, and all the best of luck. And subscribe if you have not, and check Adapt NCLEX for more of this content Thank you very much once again. Have a good day.